Well, hello, everybody. Um, Thank you all for being on here, and just want to go over some exciting research that we published a little bit ago, and it's the first of its kind. I know there's a lot of us on here tonight. We saw upwards of 70, 80 people that were logging in. A lot are docs. There's a lot of patients. There's a lot of attorneys. So I'm going to try to keep this as fun as it could be because the material can get a little thick, right? It's research. But this is about car crashes and neck buckling. So we're going to get started. And if you have questions, you can type in, your question and so on and so forth. But I find this to be an incredibly important incredibly important topic. And the topic is, well, car crashes cause buckling and more injuries. And this was new research review that we did through professionallyintegrated.com, which is available to everyone, docs, lawyers, patients, whoever wants information and access to spinal pathology research and documentation, other stuff, and as well as our practice, my wife and I, at Katz Chiropractic in Boulder, Colorado. So we actually started this project back in 2006. Didn't take us this long to do it. We just had a lot of pauses just with life, and it took a lot to gather this data, and I'll explain why. It was really hard to do. So in order to get this project done, we had to have patients that we already had x-rays of. So their necks weren't great to begin with, right? And that we're going to talk a little bit about that in the paper for all you treating providers and such that see patients involved in car crashes. And then within about 4 weeks of time or so, they got involved in another crash. And during that time, they didn't have like a lot of corrective care. They didn't have injections or surgeries. So there were a lot of patients that we saw that we couldn't we couldn't do, such as maybe we did 6 to 8 weeks of corrective care. We were just getting ready to take another X-ray, and then the crash occurred. We don't know how much improvement we had, so we don't think that that first X-ray was as accurate. So think about how hard it is to have a patient, they get in a crash, you have their x-rays, and very shortly after, they get into another crash. Also, this is incredibly important for docs that are treating patients involved in crashes, where insurance companies will argue that people really don't get hurt in crashes, or, oh, that might be a low damage collision or a low impact. People don't get hurt. But you have to understand something. This type of study has never been done simply because you cannot get an IRB or an institutional review board. And I've mentioned this in trial before, and let me explain what the importance of that. You cannot get an IRB, which an IRB are docs, people of your community, people that are on a board that can determine if we do this study, is it safe for public health? There's no way an IRB can ever say, hey, take this person and go ahead and subject them to a car crash at any speed. Do you know why? Regardless of what insurance companies say, when they say you can't be hurt, the scientific literature is too strong that we know that at any speed, it is not safe. It is known that it is not safe to subject an individual to a car crash because the likelihood of injury has been shown. And I think that's incredibly important. I've mentioned that on the stand a bunch of times. The reason this hasn't been done is because there's no threshold that we know is safe that someone can or cannot be hurt at. They can be hurt at any speed. And we did this throughout multiple clinics. It was mine and my wife's clinic, and then we got together with some of the other authors on here that were also practicing at the time that got these patients. So the question that we're always asked, or I'm always asking, one of the questions that I asked myself is, well, how do you know that this car crash caused the kyphosis? And for the patients that are on here, some of you are my patients, others from other places. I think some on the other side of the world, and I think I saw Natasha on here. So hi, Natasha, if you are on here from the other side of I don't even know what time it is where you are. But We know that the neck should have a normal lordosis. And when it's going the other way, it's going in a kyphotic angulation like the thoracic spine. So a lot of times you ask, like, and insurance companies will ask, and lawyers can ask if it's a med legal case, well, how do you know the crash caused this kyphosis? So that's a really good question. And here's how I've always answered it. One, maybe you had prior films. You knew what this patient's neck looked like, and then they got in a crash, and then when you measure it, you can assess the difference. Most of the time, that's not what happens in the real world. Patients are fine. They get into a crash. They come in, you take an x-ray, you see there's a kyphosis. So the way that I always answer this is there's two possibilities. Either the person had an abnormal curve, like this insurance company is suggesting, and they were completely asymptomatic. If that's true, then one, we don't know if that person had an abnormal curve. We also know that most of the asymptomatic population does not have a kyphosis. But let's say they did have an asymptomatic kyphosis before the crash, which no one has images to suggest that, just what the insurance company a lot of times argues, and then a crash occurs. Now they're symptomatic. And there's evidence to suggest that if you have a kyphosis and you get hit, your neck is more likely to be injured. So now the insurance company has to agree, like, okay, maybe they had an asymptomatic kyphosis, but now it's symptomatic. That's completely different. Or we can say that the crash caused it because we have no evidence that they had an abnormal curve, and we're going to get into some of the research here. So here's on the left where it says lordosis, that's what a normal neck curve is supposed to look like. And then on kyphosis on the right, that's when the neck is going the wrong way. And there is an ICD-10 code. There's a true diagnosis code that we know cervical kyphosis is a real pathology. It's a real finding. This person has a fusion down low, but this is how we measure in our office. And then we can see this person had 144% loss with, they had a very slight anterior head translation with kyphosis at the top. So has there been evidence that car crashes do cause an S-shaped curvature? And there is. So I'm just going to hop out of here. I just want to make sure that everyone can see this appropriately and that there's okay, just making sure that you all can see this. And I'm going to go back to this and share. So how do we know that it can cause an S shape? Well, there's been a lot of studies, that cadaver studies, that at impact at approximately 60 milliseconds, the neck takes this S-shaped curvature. And remember, they can't do this on live volunteers. You won't get an IRB. There's some people who could volunteer and be like, I'll do it. But they also show it on biorid dummies, right? The dummies they put in cars, and they show that this occurs. Yale published this. Here you go. Here's a paper that was published, and actually the title of it is Whiplash Produces an S-shaped Curvature of the Neck with Hyperextension at Lower Levels. That was from Punjabi et al., and that was published out of Yale, and I believe, and published in Spine back in 1997. And the title is Whiplash Producing an S-shaped Curvature, knowing that on this biorid, this is what occurs. And that's from the biomechanics lab at Yale University School of Medicine. And I always talk about this on the stand. Like, look, even Yale studies this. We know that it's a true finding that can occur that damages necks. If you're a member of professionallyintegrated.com, many of these docs are, you could just go in and type in S-shape, and a bunch of stuff comes up with the studies that talks about facets and S-shape curvatures and head restraints, females, all sorts of different stuff. And then you could also go to the diagnosis of loss of curve. And under each diagnosis now on the side, you have causation, chronic joint, and you can click causation. A bunch of papers and videos will come up as causality relationship peer-reviewed journals show up showing what causes this loss of curve. That's one of the ways we use this site in our office is we can look and we have research on here. So the title of the paper that we published that we're talking about tonight, we got published in Journal Diagnostics, is abnormal static sagittal cervical curvatures following motor vehicle collisions, a retrospective case series of 41 patients before and after a crash exposure. And we published this with many people, D. Harrison, Ibrahim, Mustafa, who I believe is in Egypt at the university there. And this was, multiple center. So what did we find? So this is right from the paper, and I know some of this might seem boring, especially to some patients that are there, like, listening to the meat of this. But in the paper, we wrote this, and a lot of you docs, you should be able to document, put some of this in your notes with patients that are hurt and educate them on how do you know that a crash caused this, and is a kyphosis even a problem? So what we found is that previous investigations have had a correlation between abnormal curves and a variety of complaints such as pain and disability. However, no study has shown that a loss of the curve is a direct result of an exposure to a motor vehicle collision, other than in the biorid dummies. This investigation presents a retrospective, consecutive case series of patients with both a pre-injury, right, because their necks weren't great from the beginning. We didn't have an asymptomatic population that we x-rayed, and then they got into a crash. So their necks were pretty bad. And then we did a cervical lateral radiograph, which we CLR. And then afterwards, we got a post CLR after the motor vehicle crash. And then we digitized their neck. So it was done on computerized radiographic mensuration analysis. We also looked at their pain, right? So we didn't just look at their neck and the buckling and shapes. We also looked at what were their pain scores before and what were their pain scores after. Of the 41 patients that met the inclusion criteria, we did a numerical pain rating as well as a neck disability. We looked and had them fill in disability scores that were available both before and after. Out of this, we had 15 males and 26 females, aged from 8 to 65 years old. And what we found was some tissue damage that occurred. In our paper, we mentioned an anatomical non-systematic review by Curatolo et al. Found that tissue damage from collisions to the zygapophyseal joints, which are the facet joints, the annuli fibrosi, which is the disc, and partial or complete ruptures of the capsules, ligaments, and other areas. And these are all referenced in the paper. So if you want the reference, we put the reference number after this and then down below. So we know that after crashes, there's multiple tissue that can get disrupted. It could be ligaments, the facets, the discs. But in patients with injuries resulting from a motor vehicle crash, a correlation between S-shaped, a kyphotic, or a hypolordotic, a loss of the cervical curve, is correlated with cervicogenic pain, radiculopathies, and increased rates in degenerative discs have been reported due to abnormal structure. And these abnormal structural configurations are associated with multiple symptoms and a worsening of prognosis. So for the docs that are on here and for the patients, when you have an abnormal cervical curve, there's a lot of studies and evidence that increases arthritis, that increases pain. We published a paper in the Journal of Brain Circulation that it could even decrease blood flow to the brain. So why are you having this problem? And if there is a buckling, is the buckling causing these other systems to fail? And there's a lot of studies that suggest that that is true. On the site on Professionally Integrated, you could just go to facets, and here's a bunch of stuff as we talk about facets, how car crashes damage the facets, and how those facets can lead to chronic pain, irritation, joint, and neurovascular issues. We did mention that in motor vehicle crashes, we talk about how the neck and the skull gets affected during the acceleration and deceleration events, that the skull goes through a translation, which is like a slippage. And then many authors then describe an S-type curvature, or what is also considered a first order buckle mode of the normal lordosis. Furthermore, altered geometry, so a change of that neck curve, of the static curvature of the patients have been previously described as a buckled modes or different types of shades. But to our knowledge, what we looked for was that there was no study that showed that motor vehicle crashes cause or contribute to altered geometry post-crash. There's been a ton of studies that at 60 milliseconds, 40 milliseconds, the neck takes this geometry. But remember, they looked at cadavers and biorid, and on cadavers, they saw that the necks were damaged, the discs, the facets, but not on live volunteers. This is the first paper to see, did this happen to these patients? And again, on the site, here's a study that talks about the mechanism of whiplash causing an S-shaped curvature that actually damages the facet capsules and even the vertebral arteries. It can cause elongation. And this was out of the Clinical Biomechanics back in 1998, titled Mechanism of Whiplash Injury from Punjabi, which again was from Yale. And this study is on Professionally Integrated, where we use it to show our patients that car crashes, even I think this was at 5 miles an hour, damages the discs, the facet joints, and even causes vertebral artery elongation, damage to the vessels. I don't understand how insurance companies argue or how some lawyers don't see that this damage to the car or speed. It's so well published from articles from Yale, from peer-reviewed journals that car crashes at any speed can really disrupt and damage, and over 50% of patients involved in car crashes can suffer with chronic pain. So what we did is unfortunately, we started with bad necks, right? We didn't take healthy asymptomatic volunteers, x-ray them, and then just wait for them to get involved in a crash. And if someone wants to do that, would be great. But following their initial course of treatment for the non-motor vehicle related, some could have some crashes, their necks were a little buckled. They then got into an exposure in another crash like we discussed. And then we x-rayed them. And again, their motor vehicle crash exposure patient exam and radiographs were included in the patients that had to at least been within 24 hours and up to only about 4 to 6 weeks at the time of crash. So in addition to the lateral neck x-rays, we also had them do the numeric pain from 0 to 10, right? 0, no pain, 10. And then we did the disability. And of all 82, right, because we remember we had 2 sets of 41 people. We had their neck pain and x-rays before, so 41, 82. We looked at these parameters. We looked at their digitized points on their x-rays from their posterior hard palate to the posterior portion of the foramen magnum, to the anterior and posterior tubercle of C1 or atlas, and then all the vertebral bodies of C2 to C7 to measure the posterior tangent lines, to measure the actual cervical curve, both on the ARAs and RRAs, which is C2 to C7, and then also each individual vertebra. And then we calculated looking at angular rotations or translations during this, and this is how we measured it. So here's what a neck would look like. We measured from C2 to C7, measured that angle. That's the ARA, the actual rotational angle. And then we also looked at the relative rotational angles from the back of C2 to C7 on each one. So from there, we then looked at the translation. How far did their neck translate forward relative to the first time? And also we looked at anaurosthesis as the vertebra slipped forward just in a neutral position, not in we didn't do it on flexion extension. And we did publish a paper on DMXs that we did, which was one of the largest biomechanical papers looking at around 200 patients where we look to see, do crashes cause instability on movement? This was just static. So here's what we found. We found the NDI, the NRS, which was their pain score. They started, because remember they had hurt necks. They started at 2.7, right? That was their average pain score initially when they came to all of our offices, the 41 patients. After the crash, it about doubled, which is truly statistically significant. Not just statistically significant that 2.7 to 5, but there's a lot of evidence that around 5, 5.5 NRS is a bad indicator for outcomes. These patients are pretty hurt, as any patient that's on here now that has been suffering with chronic neck pain, I'm sure they can tell anyone on here how bad this pain is. But then their disability score was at 15.7, and after the motor vehicle crash, their disability index scores went up to 32. So again, more than doubled, right? So their pain scores and their neck disability index more than doubled. So the crash caused doubling of pain and doubling of neck disability index on the intake, on the forms. So here's what we found in terms of their x-rays. When we looked at the C2 to C7, which I showed you, and then we found that there was approximately about an 8 to 10 degree reduction of the overall curve, which doesn't sound like a lot, but what we also found was a buckling in the middle of the neck, which isn't going to include the angulation, right? Because C2 could be okay, C7 could be okay, but the middle could be buckled. And if you just measure C2 to C7, it may not look like much, but there was about an 8 to 10 degree average reduction of the curve as a whole. And then there was also a 6.5 degree change from that C3 to C5, showing that there was a buckle. So what we found here was, as you can see on the left, oops, let me go back here. we showed the anterior head translation and what it was from the initial to post. That 47 degrees went to 58. And you could see how each of these lines are Chamberlain line from their skull base, as well as the ARAs of C2 to C7 was a negative 17. Now, here's what's really important. Most literature suggests that under a negative 20, a negative means extension, a lordosis, um, over a negative 20 shows that most patients don't have pain. So with the further you can get under that negative 20, more into a loss of curve or kyphosis, it's strongly correlated with pain. So in our office, we want to try to get patients' necks above negative 20, right? Negative 21, up, obviously negative 40 would be great, but trying to get above that negative 20. So these patients already had bad necks with pain, but it went from a negative 17 down to a negative 9 overall. So you're getting towards that kyphosis, let alone what happened in their mid-cervical x-rays. So here's some posts, right? 2A, pre-motor vehicle crash, their neck wasn't great, but look at the difference right after the crash. Very suggestive to what Yale's biomechanical literature and other biomechanical literature shows what happens at around 60 milliseconds with this buckling. And then here's another one which doesn't look as bad where it had a curve, but it sounds crazy. And we just talked about this at a conference at CBP in Park City this weekend. The one on the right, 2D, is actually worse than 2B because 2B has this abnormal kyphosis of the anterior head translation. 2D has a lot of different modes of movement, if that makes sense. So it went from like a single to a double buckle ordering where that mechanics at 2D is very off, and those are very statistically significant changes in the biomechanics leading to worse outcomes and worse structural load. This graph here is the blue line, as you can see, is the ideal model. That's what the ideal normal curve is. That's been shown to what our neck should look like. Again, that's at negative 42, and that can go down to negative 20 is what that range is. And what that range correlates with less pain to that population. The green is when they came in with bad neck. So we're taking bad and then it got even better, right? So you can see what happens. Now, the red is right after the crash. The neck goes more anterior, so you get more anterior head translation. And look at down below. It actually goes behind the line of the green, showing that that mid neck actually buckles more. So this is the analysis that we found when we digitized it blindly. We didn't know which was the image before or after. And this is what we found was that their neck translated more. They lost more of that curve by about 8 to 10 degrees, but the mid spine buckled. So you have what's called a snap through buckling. The neck goes from this lordosis and the middle buckles on top of itself. The research shows the more abnormal mechanical loading that can increase disc herniations and pain and other aspects, not to mention how it can pull and tether on the cord. So we found that the average post-motor vehicle crash lateral cervical curve model approaches a second order buckled mode with straightening reflection of the mid-cervical segments at 4 to 6 compared to the pre-injury model. So you docs, when you're seeing patients come in after a crash and they have that, not just the loss of curve from 2 to 7, but a buckle in the middle, this is something that you can now say, based on the only study that we know of on live people, that is a direct result of car crashes, let alone what's been shown in other biomechanical studies. And then you have to then use the information in the research, and if you're on this site, what those abnormal mechanics lead to, from vascular problems to chronic issues. But during impact experiments, the cervical spine has been found to exhibit this snap through type of behavior. And again, all the references are in the paper, which you should all have. If you don't have it, you can look for it. It's on PubMed or it's open access. We paid to make sure that everyone can have it. And if not, just reach out to me and I'll send you a link. But again, here's what we found. This was published in the paper. Here's a neutral lordosis to what's called a first order buckling to another first order. Then we had a second order buckling and a third order buckling. And we see that this abnormal mechanics occurs. let me just see if I can, so anything here. Yeah, so I'm going to answer these questions, but yes, I do work with a lot of CCI patients. In fact, I published one of the only uh, papers to actually fix this and finding someone with CB. So yes, and we'll talk about that. But please keep asking. Please keep asking questions here. I want everyone to get their questions answered, and we'll get through this here in a sec. So okay, so sorry. Let me. So oops, what's this? All right. So so this is interesting. 10% of the patients had a significant segmental translation, meaning a retro or an anterolisthesis, where it slipped forward or came back. Um, so we found that 10%, and that was at 3.5 millimeters in a neutral position. Okay, so 10% of the people had instability on neutral that they didn't have before. Now, there's a lot of studies, including the big instability paper that we did, that instability is very common in car crash patients, and there's a ton of information that discusses that as well. But we found 10%. And here's what we found, right? So it's very, there's a lot that's going on here, but this shows before and after, and you can see the slippage that we put in here and the buckling that occurs. And we found that C5, C6 spondies on number 22 patient, number 24, 6, went up to 2 to 3 millimeters. So we saw that there was a shifting as well, which could be disrupting of an aneurysthesis, could be disrupting of a little bit of the posterior column, and then backwards could be a little bit of damage to the anterior column, such as the anterior longitudinal ligament and the disc. So seeing these disc injuries, these ligament injuries that could be permanent, we showed that not only did they get buckling, but even just on neutral, and we didn't even do flexion extension. So the discussion, so I don't bore you all to death, we found that the cervical model and radiographic alignment variables before and after a motor vehicle crash exposure confirm our primary hypothesis that motor vehicle crash is causing a buckling type of alignment in the sagittal cervical spine that is noted both segmentally and globally, right? We found that each segments can buckle more, and the whole neck as a whole changes its overall alignment. And again, this is right in the study. This is stuff, if you're treating patients in crashes and insurance companies are arguing, you need to make sure that you document this before so it's in their notes and educate your patients. This is something that we see. This is something that we know to improve public health. In our retrospective analysis of 41 participants, there was a general hypolordosis, so a loss of the normal lordosis of the cervical curve was identified following exposure to a motor vehicle crash and was characterized by an increase in the radius of the curvature by approximately 8 degrees reduction and a mild kyphosis of the mid-cervical spine, right? A 6.5 degree just at C3 to C5. Finally, a mild increase in forward head posture was found following the exposure. So they also got an increased CSVA, or anterior head translation, and there's a lot of evidence that that is also a big factor of poor outcomes. To our knowledge, our investigation is the first study we know to report abnormal cervical curvature within a group of patients following exposure to a motor vehicle crash. There's a lot following biorid dummies and cadavers, but this is the first one to show that it can happen in real life people. So taken as a whole, the literature detailing patients involved in motor vehicle crash and those with whiplash-associated disorders indicates that a loss of the curve, straightened curves, S-curves, and kyphotic curves are risk factors for and are statistically correlated to generalized poor long-term outcomes, including chronic neck pain. And there's the references. And on this site, there's a ton of articles talking about how a loss of curve, if left untreated, will lead to worse outcomes. They do surgeries on stuff like this, right? When it gets really bad. We're trying to fix this and prevent it from breaking down. We also found that data from Marshall provide evidence that patients involved in a motor vehicle crash have a 10-degree mean reduction in the C1 to C7 Cobb angle of cervical lordosis compared to a control group. And according to our review, the majority of the literature indicates that patients with injuries resulting from a motor vehicle crash have a significantly greater frequency and magnitude of altered cervical curve configurations. So when insurance companies ask, well, how do you know? You didn't have the x-rays before, you're right. They were either asymptomatic, and then now they're asymptomatic with a loss of curve. Now they're symptomatic, two totally different things. Or we look at the study and the crash caused it. So it either caused it to become symptomatic or the crash completely caused it. Either way, it's from the crash. In our population, following exposure to a motor vehicle crash, the average NRS pain score, again, we talked about how it nearly doubled. And of all 41 patients who were initially seeking treatment for cervical spine complaints prior to their crash, and cervical spine radiographs were required. So again, we knew their necks weren't great. So again, we took not great necks, and those necks got even worse, right? They didn't go from really good to really bad. They were like bad, and then even from bad, it got even worse. That's a pretty big buckling. So on the lateral, this is what we found is that different in comparison to the initial pre-MVC lateral radiograph, the magnitude of these segmental translations, right, of those 10% approach the limits of allowable maximum joint movement. And again, that's not even on flexion extension before instability occurs and represents abnormal alignment suggestive of ligamentous injury. Note that this threshold does not exceed the limit of true translation instability and thus is consistent with subcatastrophic or micro damage. But again, we didn't even do flexion extension. So just in the neutral, they're suggestive of ligaments. Now, to really look at ligament instability, we published this paper, me, my wife, Dr. Michael Freeman, who's a DC, MD, PhD radiologist, where we did diagnostic accuracy of video fluoroscopy for symptomatic cervical spine injury following whiplash trauma. That we really looked at instability of 37 parameters, and we found very significant changes between the motor vehicle crash groups and the asymptomatic groups, non-car crash groups. So the two different papers looking at different things, but also kind of correlate to what we found. Oops. And again, if you're docs, if you're on the site or you're not on the site, get on the site. You just go to instability, comma, crash, or go to causation. And here's, we have 400 articles on spinal pathologies and again, how instability and car crashes are correlated with the literature. So again, their pain score was a 5 out of 10, that more than doubled, and it's associated with significant disability. The significance of this increase in pain cannot be understated in our population of patients. Neck pain is one of the largest contributors of musculoskeletal global burden of disease. I'm sure any patient that's watching right now, ask them how their neck feels, that hurts. It robs them of their life. And these patients deserve good quality care. They deserve good quality representation. And, you know, the docs that are on here are great docs. Ask me in your area who's associated with the site and others, and I'll find the same with the lawyers that are on here. Like they know that insurance companies attack you and you're hurt and they drag you through the mud. But the lawyers that are watching this and associated with the site, they understand the science and they're the ones that are going to fight and help. So reach out and we'll try to find you someone that can get you good quality care. We also found that the failure to properly diagnose neck pain and the parameters of injury can lead to increased risk of chronicity. We need to identify these pathologies to give the best care so that we can minimize chronic pain and increased mechanical stress and strain on internal and external spine structures due to an abnormal curve and instability, worsen range of motion and strength, and worsen outcomes in both the short and long term, including leading to an increased rate of degenerative changes. This pathology, with the loss of curve and the buckling, is linked to more arthritis, disc herniations, and chronic pain. Now, what if we fix it? We can minimize that. Now, what if the crash caused it? Shouldn't this patient be able to get the care that they need because it's shown to help them, and then the insurance companies just argue that they're not even hurt? Let alone are they not hurt, they may end up with chronic pain and need ongoing true structural treatment. So we have this in our paper too. Trauma physicians and emergency room physicians should be aware of these abnormal spine parameters, which are visualized via cervical radiography prior to considerations for differential diagnosis, and add to the decision for invasive or pharmacological interventions, determination of referral recommendations for treatments. Again, docs, if you're on here and you're not a member or professionally integrated, we just did a webinar with the head ER doc showing how we use this site and information just like this to get into the emergency room where you get direct referrals because they need what are called altos, alternative to opioids. They see you educate them, you see these bucklings, they need to do something with these patients. you can be the person that they refer to when you show them that you're knowledgeable on this, right? They need to see this. Oh my gosh, we see here's a study after a crash. They don't have a fracture, but there's a buckle. The emergency room has nothing to do. They don't need a surgery, but let us try to find someone that understands this to send you to because it makes the hospital look better too. They're there to get better community health. So in our conclusion, an altered cervical curve was identified following exposure to a motor vehicle crash in 41 retrospective cases. The abnormal curve, again, changed by 8 degrees with an increase in anterior head translation, and 10% of the patients developed segmental translation just in neutral. We see it's a lot higher once you start adding movement, and we show that in our paper. But overall, the modeling result of the sagittal cervical lordosis indicates that the post-motor vehicle crash alignment approximates a second-order buckling, a true snap-through buckling, a true disruption to the normal structure, indicating a significant alteration in curve geometry. That's in the paper that you should be educating your patients. You should be having in your notes. And if you're a lawyer on here, asking the docs about this on the stand to explain to the insurance company, this is what this evidence actually shows. So overall, what does it mean? Well, car crashes buckle necks and they injure people, right? We know that, but here's the first one showing pre and post on real patients. These mechanical changes do not just go away like insurance companies suggest, right? Oh, you should be fine. You should be better in 12 weeks. I don't even know where that comes from. That's from a sprain strain. A buckling of the neck is not a sprain strain. It's a kyphosis, it's a change in the biomechanics. And the literature shows that over 50% of people in crashes end up in chronic pain. And when you have these mechanical changes, if you don't address them, it increases arthritis, it increases vascular issues, it increases degenerative changes, and so on and so forth. So I think that, if any patient that's on here, your providers really need to properly evaluate your neck, look at the shape of your neck, measure the shape of your neck so that it's objective, and treat it for these mechanical true subluxations for better healthcare outcomes, right? Really looking at those subluxation patterns. And, if you're a patient or you're a lawyer on here and you were in a crash and you have to have a lawyer because the insurance company's like, you should have been better. Your lawyer also needs to stay up to date with the science, and they should be a member of this site too. Anyone should be. It's giving information of what does the evidence suggest is happening. So again, that's it. There's a QR code there's two of them for the site. Um, Thank you so much from both professionallyintegrated.com and myself, Katz Chiropractic, and my wife in Boulder. And I'm going to answer some of these questions here, and I hope you found that informative. So let's see. Someone was asking also, and I got some text messages here. We'll try to find some patients that are on here that are looking for their docs in their area. So can position of teeth and bite influence posture? You know, um, I've seen people like, with splints, it could help. There hasn't been a ton of evidence that like, hey, if you put the jaw, it affects the neck, but there is a lot of evidence, and I'll show you here, that actually let me share this here, that the neck actually, oops, hold on a sec. The neck actually affects the jaw. So if you look here, there's a lot, we'll go to TMD. There's a lot of evidence that car crashes can affect the jaw, but there's a lot of evidence that patients with pain in the orofacial or TMD also have pain in the neck region. And what they found is that the neck is actually affecting the jaw a little bit more than what the jaw is affecting the neck. So a lot of times you get patients like, oh, we're going to move your jaw, and their neck pain gets worse because, again, think of this, your jaw is really your fifth extremity. It's for grabbing. So if you just stand and you open you with really good posture and you open your jaw and then you have them go forward and open again, it feels different, right? Because you're changing the angle. And the same thing here, it shows the present study of patients in WAD or whiplash associated disorder, their neck can be affecting their jaw, leading to jaw pain. So, there is a lot of evidence that it's more the neck. There are some providers such as Postural Restoration and the new Vivos Institute in Colorado. Yeah, we haven't seen any appliance, and I know that there's some of these postural programs like, oh, we're gonna give you a splint for thousands of dollars. I haven't seen any pre and post images. The only pre and post images I've seen that change is the structural stuff like that CBP has published like 200 articles on, and we see in our office. So I haven't seen that it actually does change it. And let's see. It's from Mo, fan of my research. Well, thank you. Thanks for your presentation. I'm a head and neck trauma patient, and you saw Dr. Centeno and aggressively doing CBP care. Great. I'm glad you found a great CBP provider because of your research. Oh, well, thanks. And how it can help brain. Oh, that's awesome. Well, I'm super glad. It's been very challenging navigating how to do CBP care while under the pickle procedure. Yeah, and so that is a big, thank you so much for that. Well, for saying that, Mo, and also uh, for making sure you find the right provider that's going to understand the pickle procedure and when to go late and how to adjust you in the traction to make sure that um, it doesn't affect your neck in a worse way. Um, so, there's a lot of different adjustments and tractions after the pickle. And also, like, I don't know if you had a DMX at our office, how your neck moves to see how you should or shouldn't be treated to speed up that healing. So I'm glad that you found someone really good, and I'm glad that it's helping. And again, keep pushing and reach out to us with any questions. It sounds like you have a great doc. They can reach out to me as well. So yeah, so and I don't know, I'll give it a couple more minutes, see if there's any other questions. And I hope you found that informative. And yeah, we're super happy with it. And we had no idea what it was going to show, but I'm glad we were able to get a good sample size, which was really hard, and be the first ones to really show that this is what happens. And there's some really great lawyers that were on here. There was one I was seeing. There was a Natalie Gray who's in Boulder or in Denver who was part of this site, and super smart lady. We were supposed to go to trial recently with Cheney and Galuzzi, and they've been part of this site, and we were able to just educate recently in trial and before trial. So there's some really good lawyers that are associated with this site that are here to help patients from all over. And let's see, Sam here. What type of spinal traction may be found to be most effective in restoring the cervical lordosis? So a lot of that is really depends on what type of configuration they have. So we will do like a compression extension, but a lot of times we're not really extending the skull base simply because we might see that there's some upper cervical instability of the apical or alar ligaments, and we just want to get a nice pull through their mid neck. And then we also want to look at where that hypomobility is, where we want to add movement. So a lot of it, what we've seen in our office is really a big pull through the mid neck without putting a lot of stress or strain onto that skull angle, so to speak. And let's see, so what can you say about increased anxiety and PSD after a crash? So yeah, so anxiety and stuff after a crash is, that's a real thing. And they actually looked at that and again, a lot of it is like, look, when you're hurt, um, here, I'm going to show you this here. When you're hurt, it's scary, right? And so Doc, if you're on the site, I just typed in, look, anxiety, and here's a study that I put up here about PTSD and motor vehicle crashes. And they looked at this, right? And this was published, long-term outcomes of motor vehicle injury. And they found that psychological complications are important and persistent after a motor vehicle crash. So it's a real thing, right? It happens. We know that it happens. And there's a lot of reasons in that study for it. One, you hurt. That's scary. Getting in another crash and another trauma on top of it is scary. Um, I know for myself, if I'm injured, like, man, that creates some anxiety, like pain. The patients that are on here, like that one Mo who was just talking, think about the stuff that they went through, right? That's scary. That leads, I don't know how that doesn't lead to anxiety. And then also the patients are on the road, they're constantly, that rear end, they're constantly looking now to make sure they don't get hurt again. So yeah, but you could always just hop on the site and just type in anxiety, and there's studies that come up that talk about that. So, yeah, so I'll give it another minute. If anyone has any questions, and again, there's some really good docs on here that are associated that can help. Oh, and Natalie Gray, who I was I was just talking about her. Well, she was paying attention. See, again, that's another great, and thank you so much for the helpful webinar. But again, that's what separates, in my opinion, and I have no connection to her other than she was on the site and I know she's smart. But look, this is a lawyer that's taking their time on a Tuesday night to continue to learn more. This isn't just one of those that you're looking at a billboard ad. So I'll give her props because we see patients that she's represented that the insurance companies fight, but we know these are real injuries, right? I'm not here to win a case. Um, and she's not here to necessarily, I don't want to say it wrong, win a case, just provide the facts. These are the facts. This is why this person needs care. And that's all, that's what we do as providers. So, well, thanks for coming on. I super appreciate you being on here. So let's see. Okay. So yeah, so if anyone else has a question, and we're gonna put this up also. We can email it out. We'll put it up on YouTube or something. I don't know. I'm not the best IT person. I'll have my IT person do that. But I hope you found that all informative, and I hope for the docs that are on here, you now have information that I always teach on this site to make sure you have this information in your brain, available at your fingertips. You put some of it in your notes, not just the macros, educate your patients. So you put it in there first to give whoever's reading your notes the information. So if they question it, you're like, I already gave you that. This is how you came up with it. This is why you're treating your patient. You're just trying to get them out of chronic pain. You're trying to get them out of degenerating. You're trying to get them out of having worse health. Make sure your notes reflect it. Get in and smash on to professionallyintegrated.com and become a member. It's less than one patient visit. I want all docs to have this, including the lawyers. And you can talk. I don't care if you're a defense lawyer. You're a defense lawyer, hop on, learn about the science. But docs should all have this. So again, thank you all so much. I'll give it just like another couple seconds if someone's really slow typer. I wish I knew a way you could just talk, but anyway, so thank you all so much. We're super happy with this project, and I hope you found this helpful. Hope you found it informative, and you're ready to kill it at work tomorrow and help more patients. And you can explain why. We know car crashes cause a buckling in the cadaver studies, the biorid studies, but here's the first one that suggests this is what happens. It buckles the neck, causes annulolisthesis, and then do those motion studies to see if there's instability. So thank you all so much. Have a great night, and we'll talk to you very soon. Again, if you're not already on professionallyintegrated.com, what are you waiting for? Hit me up and I'll give you a free Zoom to show you how to use it to make your practice more informative and educational and strive for better patient outcomes. Thank you all so much.